Good afternoon, everyone, and thank you for joining us for today's webinar. As a reminder, this webinar is being recorded and a recording will be shared with you. Please use the chat feature to submit your questions during the webinar. We will do our best to answer as many questions after the presentation as possible. For any questions we are unable to answer in today's webinar, we will be able to get those to you in a frequently asked questions document that will be shared with you after the webinar. Additionally, a link to PANDA's resources, including our Medicare Reforms Education Hub, will be shared. PAN does have ASL interpreters for today's webinar for anyone who may benefit. I am now pleased to introduce you to PAN's President and CEO, Kevin Hagan. Kevin?
Thank you very much, Cassie. And on behalf of the entire PAN family, I want to welcome you to our webinar series today on Medicare changes that are coming in 2025. I'm Kevin Hagan, the President and CEO here at the PAN Foundation, and we are honored and thrilled to have all of you join us today. I think most of you who are attending understand that there are some pretty significant changes coming in 2025 to the Medicare program. And what we wanted to do is take this opportunity to have you hear from some of the PAN team about what those changes are and how they can impact the patient experience in a very positive way overall. I mean, most of these changes are going to be very positive for the patient community, but also sometimes cumbersome and difficult to understand. So I think it's critically important that people spend this time and energy to understand some of these significant changes that will ultimately, we believe, have a very positive impact on you and your families. So with that, I wanted to introduce you to our speakers for today. So I am joined, and this session will be led by two amazing PAN team members. First of all is Amy Niles, our Chief Mission Officer here at the PAN Foundation. Amy is probably, and I say this with all sincerity, one of the country's best experts when it comes to these Medicare reforms. She not only speaks on behalf of PAN, but she is sought after by other organizations throughout the country to speak on the changes. And she's pretty much been on a nationwide tour lately at conferences and other disease-specific organizations, spending time and energy sharing what these changes mean for the patient population. So we are thrilled to be joined today and have Amy lead this. And alongside of her is our Director of Clinical Affairs, James Ridley. James works diligently here at PAN to make sure that our patient population and PAN grant recipients have access to the best and latest therapeutics that are available by working on our formularies, but also really works across our spectrum in working with our providers and in our community engagement work to ensure that people all across the country are aware of the resources that they can access through the PAN Foundation. So without further ado, I will turn it over to Amy and James to get us started.
Thank you, Kevin, and welcome to our annual webinar. James and I are happy to be with you to share important information about key changes coming to the Medicare program on January 1, 2025. We will also discuss the impact these changes may have on the assistance you receive from the PAN Foundation. First, let's have a brief refresher about the Medicare program. When I think about the Medicare program, I sometimes think of the alphabet soup. The Medicare program is made up of 4 parts. Part A is your hospital insurance. It covers hospital stays, hospice care, and other services. Part B, as in boy, is your medical insurance. This covers doctor's services, lab tests, and preventive services. Part C is also known as Medicare Advantage. This covers Parts A and B and often includes benefits such as dental and vision services. Many Medicare Advantage plans include prescription drug benefits, but not all. Part D, as in David, is the focus of today's discussion. Part D provides coverage for your prescription medications and can be offered through a standalone plan or through Medicare Advantage. So now we're going to turn our attention to the Medicare reforms that were passed as part of the Inflation Reduction Act in August of 2022. Next slide, please. The Inflation Reduction Act passed into law 6 very important Medicare reforms, which started taking effect in 2023. In 2023, we saw Medicare beneficiaries benefiting from being able to access vaccines without any copays or cost sharing. For millions of people living with diabetes, having an insulin cap of $35 per month was a welcome reform. This year, we saw 2 additional reforms. The Federal Extra Help Program, also known as the Low-Income Subsidy Program, expanded. Now, people up to 150% of the federal poverty level, very low income, and those with limited resources fully benefit from this program, which means that most, if not all, of their out-of-pocket prescription costs are covered. And finally, this year, we saw the 5% coinsurance in what's called the catastrophic phase of the Medicare benefit be eliminated. In essence, this has meant that people on Medicare have experienced between $3,300 and $3,800 max in their out-of-pocket prescription costs for the year. And now, just 6 weeks away, 2 additional reforms will take effect on January 1, a Medicare Part D cap and implementation of the Medicare Prescription Payment Plan. For more than a decade, PAN has advocated for these reforms, especially those coming in 2025. In fact, PAN pioneered conversation around what we call smoothing, now known as the Medicare Prescription Payment Plan. So let's dive in to learn more. We will review today the details of both of these reforms. But first, let's take a quick poll to see how familiar you are with our first reform, the Medicare Part D cap. So we're going to take a moment to complete the poll. How many of you are aware of the Medicare Part D cap? I've never heard of it. It sounds familiar, but I'm not sure. I've heard of it, but I don't know a lot. I know the program well, but I'd like to learn more. I'm a Medicare Part D expert. Click the circle that best describes your knowledge of the Medicare Part D cap, and we'll just take a moment. Okay, let's close the poll and see what all of you are saying. Not surprised, and I'm glad to hear that many of you have heard of it, but we do have a lot more education to do, which is why we're so happy to be with you today to share this information. So we will start our discussion with the Medicare Part D cap and then transition to our second reform, the Medicare Prescription Payment Plan. Beginning in 2025, there will be a limit on what you spend out of pocket for your medications in the Part D program. This limit, or cap, is $2,000. This cap only includes medications covered under Part D, as in David. It does not include medications under Part B, as in boy. The nice thing about this reform, it's automatic. Other than having Part D coverage, You don't need to do anything. Like you do now, you will continue to pay for your medications at the pharmacy counter unless you opt into the Medicare prescription payment plan, which we will review in a moment. The Medicare Part D cap benefits everyone, especially people who have been used to spending more than $2,000 for their medications. Data tells us that by the time we hit June 30th of this year, nearly 5 million people on Medicare had already reached the $2,000 threshold. So we'll dive now into the Medicare prescription payment plan. But first, let's do one more poll. How many of you are familiar with this reform? And let's take another moment. How many of you are aware of the Medicare prescription payment plan? Never heard of it? It sounds familiar, but I'm not sure. I have heard of it, but I don't know a lot. I know the program well, but I'd like to learn more. And I'm an MPPP expert. We'll take a few moments. Okay, let's close this poll and see what all of you are saying. Yeah, as I thought, we have a lot more education to do around the Medicare prescription payment plan, but I am glad that there are many of you who at least have heard of it. So we'll close the poll. The Medicare prescription payment plan is much more complicated than the Part D cap. To walk you through it, we'll go through each of the questions you see here on this slide. The Medicare prescription payment plan is a new voluntary payment option for your prescription medications. By law, all Part D plans, both standalone and Medicare Advantage, must offer their enrollees the opportunity to spread their drug costs and payments throughout the calendar year. While the Medicare Part D cap may lower costs for many, the payment plan may make these costs more affordable. Unlike the Part D cap, which is automatic, you need to take action to benefit from this reform. If interested in participating, you need to opt in directly through your Part D plan, either by calling them, and their number is on the back of your insurance card, or visiting their website. The Medicare prescription payment plan only applies to drugs covered under Part D. It does not include drugs covered under Part B, as in boy. Now, the Medicare prescription payment plan is good for patients, but it may not be beneficial for everyone. It is especially beneficial if you have a hard time paying for all your medications at once, or if you simply want to budget and spread out these costs. If you have spent $2,000 or more in the first 9 months of this year, the payment plan could be beneficial. Similarly, if you have had one prescription fill of $600 or more, you might consider opting in. If you are not eligible for assistance through the federal Extra Help program, the payment plan may be beneficial. Generally speaking, if you cannot get assistance from a foundation like PAN, you might want to consider opting into the program. Now, the best time to opt into the payment plan is now, during open enrollment, or at the very beginning of the calendar year. We'll discuss open enrollment in a few minutes. The reality is, though, you can opt into the Medicare prescription payment plan at any time during the year. However, the later in the year that you opt in, the fewer months you will have to spread your costs. CMS, or the Centers for Medicare and Medicaid Services, has developed a standard formula that all Part D plans will use to identify your month-to-month costs when you opt into the Medicare prescription payment plan. Your Part D plan will be sending you a bill each month for what you owe for your prescription medications, and that bill will include the date by which payment must be made. You will be paying your Part D plan directly. You will not be paying for your prescriptions at the pharmacy counter. We will go through some examples in a moment, but the bill from your Part D plan will be based on what you would have paid for your prescriptions, plus the previous month's balance, divided by the number of months left in the year. Now, payments may change from month to month based on your needs, so it could be hard to predict future payments. As your needs change and new medications may be needed, their costs will be woven into the formula. What you should know is that by the time you reach the end of the year, you will not have paid more than $2,000 due to the Medicare Part D cap. We will go through 3 very different scenarios now, in part to demonstrate the complexity of this reform, but also to show how at the end of the day, it's up to the individual patient to decide if the payment plan is right for them. Now, in our 3 examples, the middle column is what the patient would pay without opting into the Medicare prescription payment plan. The 3rd column is what payments would look like with the plan. So example 1, Joan spends $500 per month for her medications at the start of the year. She opts into the payment plan in January. According to the formula Part D plans will use, the first step is figuring out what's called the maximum possible payment for January. To do this, we are going to take the $2,000 cap. We'll subtract 0 from it because Joan does not have any prior out-of-pocket costs, and we'll divide that by 12 months of the year to get $166.67. Since $166 is less than the $500 she would have paid in January, the Part D plan will only bill her that $166 in January. Now, her remaining balance in February is the $500 from January, less the $166, which is about $333. We're adding the new $500 from February onto that balance of $333 to get $833. And now we're going to divide that by the 11 months remaining, and we get $75.76 as her payment for February. Now, notice that without the payment plan, Joan would reach the cap of $2,000 after April. She would not be paying any more after that. Now, we won't go through the remaining calculations with the payment plan, but you'll see that with the payment plan, her costs vary a bit from January through March, and then will be about $181 every month thereafter. Well, Joan will need to decide what she wants to do. Would she prefer to pay $500 for the first 4 months and be done? Or is spreading her costs more affordable? It will be her decision. Let's consider George. George spends $80 per month for his medications and also opts into the payment plan in January. Like Joan, his maximum possible payment in January is also $166. However, since $80 is less than the maximum possible payment, his Part D plan will only bill him $80 in January. Well, what happens in February? He has $0 remaining balance, and now we'll add on the $80 for February. That's $80 total, and we'll divide that by 11 months remaining in the year. His Part D plan will bill him $7.27 in February. The formula continues, and you can see what happens to his payments throughout the year with the payment plan. I think George may decide not to opt into the Medicare prescription payment plan. So let's look at our final scenario. Phyllis pays $4 every month for a prescription. In April, she has to pay for an expensive $613 medication. She also opts into the payment plan in April. She has some large costs for her medications in July and October as well. For Phyllis, the first month's maximum possible payment, which is for April, is calculated a little differently. We take the $2,000 cap, we subtract $12 from it. That's the $4 per month from January through March to get $1,988, and we'll divide that by 9 months remaining in the year to get $220.89. For April, since $220 is less than $617, her plan will only bill her the $220. Again, we won't go through the subsequent calculations, but notice the variability between April and December. If Phyllis is concerned about paying $617 in April, she may be interested in opting into the plan. If she is concerned about higher costs later in the year, she may choose not to opt in. Ultimately, it is up to Phyllis to decide what is best for her based on her budget and comfort level. Now, fortunately, Medicare Plan Finder has developed a tool that will allow you to review what the Medicare prescription payment plan may look like for you. I know that many of you are likely familiar with Plan Finder. Starting at the Medicare.gov site, you can begin by indicating what plan you're looking for, Medicare Advantage or a drug plan, Part D, or a Medigap policy. You'll be asked whether you currently get help with your drug costs, and as you compare plans, whether you want to see the actual drug costs. This is an important step in the process. You'll enter all your known prescription drugs, your address, and can select up to 5 pharmacies to compare. You'll then see the plans to evaluate, and you can compare costs by pharmacy. Notice that there is a highlighted box about the Medicare prescription payment plan. If you click on that bottom link, find out what your drug costs might look like with this payment option. It takes you to a table listing out what your costs may be under the payment plan. Unfortunately, you cannot opt into the Medicare prescription payment plan through Plan Finder. That may come in the future. For now, we recommend that you use Plan Finder to help you decide if the payment plan is right for you, and then go to your Part D plan to opt in if you decide it is. So let's talk about the bills you will receive from the plans. Each bill will indicate what is owed and the date by which payment must be made. If a payment is missed, the plan will send a reminder. You have up to 60 days to pay the unpaid balance, at which time, if remaining unpaid, the Part D plan will disenroll you from the Medicare prescription payment plan. You will not be disenrolled from the Part D plan itself. You will not be disenrolled from the Part D plan itself. You can always opt in again after unpaid balances are paid. Now, opting into the Medicare prescription payment plan is an annual requirement, even if you stay with your current plan. Of course, if you change plans, you need to opt in with the new plan. If you opt in and afterwards decide it really is not right for you, you can opt out simply by contacting your plan. This will not impact your participation in the Part D plan. Unpaid balances will be owed, and after opting out, you will pay for your medications again at the pharmacy counter. Well, let's summarize some key points about the Medicare prescription payment plan. This plan may make your drug costs more affordable by spreading costs and payments throughout the year, but it's not for everyone. We recommend that you first explore options to lower your costs, such as the Extra Help program and financial assistance through foundations like PAN. You will be receiving 2 bills from your Part D plan, one for your premium and the other for your drug costs. If you have difficulty affording these costs, we recommend that you always pay your premium bill first. This reform comes with changes for the Part D enrollee. First, the enrollee needs to take action to opt into the program. And secondly, as we have discussed, this will change how you pay for your medications. Now, I know I've shared a lot of information about both the Medicare Part D cap and the Medicare prescription payment plan. Let's review these two historic reforms side by side. Does the reform lower my prescription costs? The cap of $2,000 puts a limit on what you spend and may very well lower your costs. The payment plan does not lower your costs, but it may make them more affordable. Who's eligible for each? Well, anyone with a Part D plan will benefit from the cap. Anyone enrolled in a Part D plan is eligible to opt in to the payment plan. What actions must I take to benefit? For the cap, nothing. It's automatic. Since the payment plan is voluntary, you need to call or visit the plan's website to opt in. How will I pay for my medications? With the cap, you'll pay at the pharmacy counter. If opted into the Medicare prescription payment plan, you'll be billed monthly by your Part D plan. Open enrollment, which started on October 15th, is an important time which people on Medicare evaluate their Part D plans. We have almost 4 weeks remaining in open enrollment. It ends on December 7th. For about 2 million people on Medicare, their plans will no longer be available in 2025 or will no longer serve their counties. Unfortunately, 7 out of 10 people on Medicare do not take the time to evaluate their plans each year. Of any year, this is the year to do so. Remember, your needs may have changed, provider networks change, cost sharing may change, what drugs plans cover may change. So please take time to evaluate your plan. And we'll spend just a few moments on how to evaluate plans. Start with Plan Finder on the Medicare.gov website. Think about your health needs, what medications you need, what providers you want to keep, and any treatments you know you may need this coming year. You can review plans in both Original Medicare and Medicare Advantage, and ultimately, don't let dollars solely determine your decision. Make sure the plan can address your health needs. As a reminder, Original Medicare includes Parts A and B, the hospital and medical insurance. You can consider a Medigap policy or a Medicare supplemental insurance to help you pay your share of costs not covered by Original Medicare. And you will consider a Part D plan either through a standalone drug plan or Medicare Advantage. Now, Medicare Advantage plans are offered by Medicare-approved private companies. You will have Medicare Part A and B, and most will provide Part D coverage. Many people are attracted to Medicare Advantage because of additional benefits offered, such as dental and vision services. Remember, every Part D plan is different. Each plan decides what medications it will cover or not. You likely are familiar with plans' tiering system. Low-cost medications like generics are usually on their lowest tier. These will cost you the least, while the high-cost specialty medications are on the highest tier. These will cost you the most. Checking Part D plans' formularies or list of covered medications is key. Plan options will, of course, depend on where you live. If you decide that the Medicare prescription payment plan is right for you, we recommend that you opt in now or prior to January. That way, when it goes into effect on January 1st, 2025, you are all set. We've shared a lot of information with you today. Please note that there are resources you can rely on in the future. You'll find a very comprehensive Medicare Reforms Education Hub at panfoundation.org. Of course, Medicare.gov is a resource to all of you. Few people are familiar with a great program known as the State Health Insurance Assistance Program. By contacting them, and their website is shiphelp.org, you can get free personalized counseling from SHIP staff. They can help walk you through the complexities of the Medicare program. Finally, if you think you may be eligible for extra help, please look into this program through the Social Security Administration. We know that there are at least 3 million people eligible for this program, but they are not aware of the program or have not applied. So now I would like to turn it over to my colleague, James, to give us a refresher about PAN financial assistance, how our grants may be changing, and he will also share information with you about Fund Finder, an important tool for you to use. James?
Thank you, Amy, for sharing a brief history of the Medicare program, 2025 Medicare Part D reforms, and for reviewing the expected changes due to the Inflation Reduction Act. Greetings, everyone. I am James Ridley, the Director of Clinical Affairs here at the PAN Foundation. The Clinical Affairs Department plays an important role in our mission to improve access to critical medications for patients in need. Our commitment to patient care and strategic guidance drives our organization's success and impact. So we provide 3 types of financial assistance. The PAN Foundation is a charitable foundation and healthcare advocacy organization on a mission to accelerate access to affordable, equitable healthcare. We do this by providing financial assistance to help patients with their out-of-pocket costs for over 80 diseases, advocate for policies that increase access to care for all, and educate patients and others about the complex healthcare topics. Since 2004, we have provided over 1.2 million people living with serious illnesses to start and stay on treatment. PAN offers 3 types of funding that cover a broad portfolio of over 80 oncology, chronic, and rare diseases, ensuring that patients facing a variety of serious health conditions can receive the financial support they need. Medication copay and deductibles, health insurance premiums, and transportation assistance. About the PAN Foundation's disease funds, assistance amounts are tailored to each disease fund and cover the average annual out-of-pocket costs associated with each disease. We aim to remove patients' financial burden while they navigate the challenges of managing their healthcare expenses. Our programs enroll patients for a 12-month eligibility period. This includes a 3-month look-back period for each new grant. Patients or healthcare professionals, pharmacies, or providers should submit a claim or reimbursement request every 120 days. This structured approach allows us to address patients' needs in a timely and organized manner. If we do not receive a paid claim within 90 days, we'll send a letter. If we haven't heard back by the 120th day, the funds are released to help others in need, making sure our resources are distributed effectively. We understand that some patients may require ongoing assistance, and we are committed to supporting those who rely on our programs. If a patient is eligible for a renewal, they can apply 1 month before the eligibility period ends. However, please note that this option is subject to funding availability. I know this feels like a lot of information, but do not worry. All of this is available on our website for your review. As you can see, we offer various disease-specific funds, including those for autoimmune diseases, blood disorders, eye diseases, oncology, lung, infectious diseases, and metabolic disorders. Many patients struggle with reliable transportation, which can lead to poor health outcomes and restricted access to necessary care. To address this issue, PAN offers a transportation assistance program. This program helps patients easily access healthcare services, obtain social support, and even travel to essential places like the grocery stores or food banks, ensuring they receive the care and resources they need and deserve. 8,400 plus patients have been provided with our transportation assistance. Now let's discuss the changes to our grants. Our grants are designed to cover 100% of out-of-pocket prescription costs for patients, and that is not changing. This commitment has been our core principle, and we remain dedicated to upholding it. We are adjusting our 2025 grant amounts after a careful review of the upcoming Medicare changes, but it is important to note that this is a routine process for the PAN Foundation. We review our grant amounts every year. We also take into account with Part B billed medications are not included in the $2,000 cap, so patients may require additional assistance. We want to put your minds at ease and know our support will still be here, and because 97% of PAN Foundation grant recipients have Medicare insurance. So now let's focus our attention to the changes to PAN grants in 2025. Regardless of the patient's insurance type, the grant amounts are being adjusted across disease funds. These changes are meant to make sure that we can continue to provide patient-assisted programs that cover 100% of out-of-pocket costs for patients due to the changes in healthcare. Patients who have already received a grant in 2024 should not worry about the changes in the grant amount. The changes will only affect patients who apply for a new grant, seek additional funding, or apply for a grant renewal in 2025. Until the end of their eligibility period, patients who received a grant in 2024 will continue to receive the full grant amount they were given initially. We have had several questions about this, so I want to emphasize that your grant amounts will not change when we hit January 1st, 2025. They are based on when you applied for and were approved for your grant. It is important to stay up to date with any upcoming changes to PAN grants and Medicare reforms. Therefore, we strongly suggest that you visit our dedicated web pages at panfoundation.org/reforms. This web page will provide you with the latest information around changes to PAN grants and updates on Medicare reforms. It is a valuable resource to stay informed about changes. In addition to our Medicare reforms guide, you can visit the Find a Disease Fund webpage on panfoundation.org/funds starting January 1st, 2025, which will help you quickly access the grant amount for the specific disease fund. This user-friendly webpage goes over grant amounts and information for each disease fund we support. We always have access so that you will always have access to the latest information you need. And we encourage you to use our online resources for up-to-date information and support. I would like to share an important tool with you called Fund Finder. Staying informed about the availability of financial assistance is crucial, and we are dedicated to making it as convenient as possible for you. To empower you to take control of your access to assistance, we offer a free tool called Fund Finder. With Fund Finder, you have the option to sign up for emails or text messages, which will let you know when financial assistance becomes available at any of the 9 charitable patient-assisted foundations. This valuable tool is a reliable way to receive timely updates about financial support opportunities so that you are well informed and can take advantage of the resources you need. To get notifications, you can access Fund Finder at fundfinder.panfoundation.org. Thank you for your time and attention today. Amy will now close us out.
Thank you so much, James. We encourage all of you to stay connected with us and receive email updates and our monthly newsletter. We also encourage you to connect with us on our social media platforms. With that, we'll conclude our webinar and begin our question and answer portion by answering several questions that were asked by many of you as you registered for this webinar. Then we'll turn it over to some questions that we've received during the chat. Please know that we'll be following up after the webinar with a frequently asked questions document so that we can address the many questions you have. So let's turn to question 1. Are Part B billed prescription drugs covered in the $2,000 Medicare Part D cap? And Part B drugs includes, for example, infusions that you might receive in the doctor's office. And no, the Medicare Part D cap only includes drugs covered by the Part D program. Question 2. These reforms are positive for patients, but are there any challenges? This is a great question. The Medicare reforms result in more financial burden to the Part D plans. With increased financial liability, the patient advocacy and provider communities will be monitoring to see if plan behavior changes. For example, will plans decide not to include certain medications on their formularies? Will patients face greater cost sharing for their medications? Will the use of prior authorization and step therapy increase? These are often termed the unintended consequences of the reforms, and monitoring will be important. Question 3, what are some important items to check when reviewing plans during open enrollment? And remember, open enrollment ends on December 7th. When evaluating plans, ask yourself, are the medications I need included in the Part D plan? Is my provider included in network or out of network? What does cost sharing look like for my medications? Will prior authorization be required? Those are just a few items, important items for you to consider.
Question number 4, how would PAN grant amounts impact people taking medications covered by both Part D and Part B? So as we evaluate grant assistance amounts, we review the formularies to consider whether the medications needed are mostly covered by Part D program or a mix of drugs covered under both Part D and Part B. If it is the latter, the assistance amounts may end up being higher. Please note that we offer additional funding, but I would like to stress this is subject to funding availability.
So we do have a few minutes remaining for some additional questions, which will open it up Cassie, what's our first question?
Thanks, Amy. We have over 100 questions here, but this first question is, how does this cap affect individuals with lower incomes?
The cap applies to all individuals with Part D coverage without regard to income levels or any eligibility criteria. Beneficiaries with lower incomes are encouraged to apply to Medicare's Extra Help program if eligible, and while the cap still applies, your out-of-pocket costs will be minimal if enrolled in Extra Help. And just so everyone knows, that 150% of federal poverty level equates to $22,590 in income for an individual and $30,000, $660 for a married couple.
Great.
have
Thanks,
next-
Amy. We do have another question here. This one says, if I opt in to the Medicare prescription payment plan and switch mid-year to a different plan benefit package, or known as a PBP, offered by the same Part D sponsor, can the Part D sponsor keep my medication prescription payment plan participation active under the new PBP?
Thank you, Cassie. Actually, this was mentioned in Amy's portion of the presentation. So as long as you remain with the same Part D plan, your participation in the Medicare prescription payment plan should continue. If by chance you choose to switch to a new Part D plan, you will need to opt into their Medicare prescription payment plan.
Wonderful, James. Thank you. And I think we have time for one more. What happens if I miss a monthly payment while participating in the Medicare prescription payment plan?
This is a common question that I have received a lot about missing payments. Remember, you're going to be billed monthly by your Part D plan, indicating what you owe and the date by which that payment needs to be made. If you miss the payment, you will get a reminder from the Part D plan. But if after 60 days you have not paid what's owed, the Part D plan will disenroll you from the Medicare prescription payment plan. They'll disenroll you from the payment plan. They will not disenroll you from the Part D plan itself. You can always opt in to the Medicare prescription payment plan again, but only after the unpaid balances are paid. And again, remember, you're going to receive two bills from that Part D plan, your premium bill and your prescription bill. And always, always make sure you're paying your premium bill first. So those were great questions. Thank you so much for submitting them. I know we have a lot of work in answering all the questions that have come in today. We hope that you have found the information about the Medicare Part D cap and the Medicare prescription payment plan helpful, and learned about how changes in the Medicare program may impact PAN grants. Please be sure to visit panfoundation.org for more information, and also consider registering for Fund Finder if you're not already a user. And finally, please take time, if you have not already done so, to evaluate your Part D plan during the open enrollment period ending December 7th. As a reminder, we'll be following up soon to provide our slides and answers to frequently asked questions. On behalf of the entire PAN team, thank you for joining today, and we wish all of you a wonderful holiday season.